And with respect to the fatalities, again, more than two-thirds in the over 60, but we have seen cases in among the younger population, including a couple of infant deaths and deaths in people under 15. And this, again, is another cause for concern because we're seeing rapid spread and spread to younger age groups than were previously affected, and that's showing up in the deaths. Looking at the, moving on, the geographic distribution, the population centers, the more populated areas are seeing large numbers by community. And if we look at the next slide, which is the week on week, we're seeing that there have been increases in most counties from the previous week to the most recent. Same data over a longer time period from week 25 through to week 47, increases all the way through over the last 3 to 4 weeks of the graph. And if we look at how that projection that we had been making on the next slide shows up, we're seeing that the cumulative numbers of cases that we have had within the last few weeks has more or less met the most recent set of projections using the rates we were moving at from mid to end of November. So whereas we may be seeing a small fall away, it's not a massive breaking force at this time. And again, it's just another call to increase the breaking force by increasing our vaccination rates and increasing our adherence to those public health measures. So without further ado, I'm going to turn you over to Dr. Richards for the clinical update.
Good afternoon to the Honorable Prime Minister, the Honorable Attorney General, Honorable Ministers of Health, Energy and the Office of the Prime Minister, and Public Administration and Digitization. This afternoon, I'd like to thank all members of the media that are here in attendance, the colleagues of my health team, and the viewing and listening population as I share a brief update on the status of the parallel healthcare system as of 8 a.m. this morning. The parallel healthcare system continues to be progressively strained on a daily basis since October 19, 2021, and congruent with the increase in the rolling average, which is currently at 657 as of yesterday evening, we continue to note an increased demand for high acuity, and that is care for severely and critically ill patients, especially in the intensive care unit category. This is one of our graphs that we often refer to, and it demonstrates that on a daily basis, an additional burden is being placed on the parallel healthcare system. And this burden is really due to an increasing number of persons that are seeking care that require hospital treatment. And these persons are so ill that they are unable to be discharged at a frequent rate. So it results in persons and additional persons being added to an already strained parallel healthcare system. Now, I'd like to just look at this, refer to this graph, and to point out a different trend that was noted from October 19th to present. The number of patients in the parallel healthcare system as of this morning is 732, broken down into 540 in hospitals and 190 into step downs. And I have to note that the step down facilities are now more high acuity, meaning that more ill patients are being managed in these facilities and require oxygen care and higher resource allocation. However, from the October period to present, the Ministry of Health recognized the need to increase the level of care at the accident and emergency departments within the parallel healthcare system. And at that point, the accident and emergency departments became equipped with dedicated staff and equipment to manage persons who were coming in very ill, persons who required ventilation at that point in time. This morning, there are 202 patients across 10 accident and emergency departments in the parallel healthcare system, in addition to the 732 in the system. So that's a total of 934 severely and critically ill COVID positive patients in our health system. There are 38 intensive care unit patients in the accident and emergencies many of whom are too ill and too unstable to be moved, even when a bed becomes available. Furthermore, 90% of the patients that we have seen over the past 61 days in the intensive care unit are not fully vaccinated, both in the accident and emergency departments and across our hospitals in the parallel healthcare system. We would notice an increasing occupancy level. We are at 81% overall occupancy today, 85% in Trinidad and 54 in Tobago. The highest occupancy levels are again in the intensive care units. You see, today our intensive care unit levels are 97%, and on a daily basis, we attempt to scale resources up to deal with the increased demand for patient care. This graph is just a visual to demonstrate the increasing number of patients presenting to the accident and emergency and ultimately receiving care at that site due to their clinical status and clinical condition. And you'd notice that from on or about mid-October, this number and this quantity has increased significantly. This is just a reference point. Between the 15th of July onwards, we noted a plateau period in terms of the hospital occupancy, and that was a 113-day period. On the 8th of October, at our accident and emergency departments, we noticed a data point, which we spoke about. And then from the 17th of October onwards, we have seen a rapid increase in the number of persons who are severely and critically ill going into the traditional healthcare system. Today, we are at 202. In closing, I would just like to summarize the trends that have been noted over the past 61 days. We continue to see severely and critically ill patients presenting often too late for effective treatment at our accident and emergency departments. We continue to see a large number of deferrals, denied admissions, refusals when the GMRTT is contacted to a patient's home when their clinical parameters worsen, that is, they get short of breath. The percentage and the proportion of persons who are not fully vaccinated in the accident and emergency departments and the hospitals and those with poor outcomes continues to be on our average 90%. So 9 out of 10 persons in the parallel healthcare system, whether ward or ICU, are not fully vaccinated. The parameters that support the system, the ambulance system, human resources, and equipment continue to be stretched. Our rolling average for ambulance usage is now 48%, up from 25 to 30% during our plateau phase. On behalf of every frontline worker, the health team continues to request that the population please take up this offer on vaccination. We are trying our utmost best to be resilient, but every day we are stretched more. Thank you very much.
Thank you very much, Dr. Richards. At this stage, I'd like to ask the Minister of Health to bring us up to date on our vaccination efforts.
Thank you very much, Honorable Prime Minister, fellow cabinet colleagues, Dr. Parasram and his team, ladies and gentlemen of the media, ladies and gentlemen of the viewing and listening public, wherever you are, thank you for tuning in today. Um, Before I give the vaccination figures, I want to talk about vaccinations a little later after I give you an update on the Omicron variant in Trinidad and Tobago, which will then impact on what I say about vaccinations. So on Monday the 13th, we came to the public and announced that we had detected our first case of the Omicron variant in a passenger who came in to Trinidad and Tobago um, via Panama from New York. Those circumstances are well rehearsed, no need to go into details there. I am to now update you on further detection of the Omicron variant in Trinidad and Tobago. We have now moved from one case to three cases, and I will now give you as many details as to these two new cases that I can. You may recall there was a flight from Puerto Rico that had to be a flight that had to be diverted to Puerto Rico, sorry, and those passengers had to overnight there. There were 16 persons on that flight who had their 3-day PCR, but because of the long stopover in Puerto Rico, for factors well known in the public domain, 16 of those persons, their PCR test would have expired, gone past the 3-day limit. When they arrived in Trinidad and Tobago, as per protocol, all 16 were quarantined and retested. Out of that batch of 16 that were quarantined and retested, we got one positive case of Omicron. All 16 of those were fully vaccinated, and the one positive case for the Omicron variant is in isolation. So that's the second case that we got. We got a third case that was unrelated to that flight. This is another flight coming into Trinidad and Tobago from Miami on the 8th of December. This person complied with all the requirements of the TT pass, had a negative PCR, correctly so, was vaccinated, but then turned symptomatic on December the 10th. This person behaved in a very responsible manner, got tested, and because we try to go after high yield targets for genomic sequencing, especially those who test positive with a travel history, that sample was sent for genomic sequencing, and we got it turned around in a very short space of time because we prioritized it. And that person turned out to be the third Omicron variant in Trinidad and Tobago. That person has one household contact, and both individuals are in home isolation. So we now have three Omicron variants in Trinidad and Tobago, known Omicron variants, and that is a key word, known, all three with a travel history. So that is where we are. Another development coming out of WHO is a new vaccine that has been given emergency use license called Covovax. It is a vaccine being produced by the Serum Institute of India under license from the company Novavax. It has been before WHO for some time, so it adds another vaccine to the armory of vaccines approved by WHO. So it's Covovax. Its technical name is NVX COV 2373. We have already alerted the TT Travel Pass folks who manage the TT Travel Pass at iGovTT to now include this in the list of approved vaccines for persons entering Trinidad and Tobago. So just to recap what I've just said, two new cases of Omicron, one from the Puerto Rico cohort, one from coming in from Miami. Those two cases are in fact isolated. I now turn to the vaccination numbers. And the reason now is that, ladies and gentlemen, globally, the Omicron variant is now in over 90 countries. It is spreading, to quote one of the public health experts in Europe, at lightning pace. Lightning pace. It is only a matter of time before we get Omicron out of travel. Um, we that is the reality of how this thing happens. And what I'm encouraging people to do again, the best way to prevent a collapse of the healthcare system is to get vaccinated. So let's talk the vaccination numbers now. And this is why I left this for last. Our vaccination numbers for those accessing first dose of a two-dose regime have dipped to about 5 to 700, more like 7 to 800 doses per day. When you add that to the J&J, which is now averaging about 175,000, we are not even touching 1,000 vaccines a day for persons accessing either a first dose or a two-dose regime, or the J&J one shot and done. Our fully vaccinated cohort, as you see on the slide, is now 659,702, which is just about 47.1% of the population. We have been stuck at 45, 46, 47% for far too long. The needle isn't moving, and we need to accelerate that, especially with the Omicron variant, which is causing havoc across Europe, causing havoc in the United States, and causing havoc because of its exponential spread in every of the 90 countries it is in. Compounding that, and to add to that, is where are we with our vaccination booster program? We started the booster program this Monday, Monday the 13th. But prior to that, we had started the additional dose regime. At the start of Monday, we had about 43,000 persons already accessing the additional doses from Tuesday, 9th November. From Monday 13th to Friday 17th, we have now moved to 54,055. What it means is that roughly 2,200 persons are in fact accessing their booster shots. So the booster program is now giving us a yield of about 2,200 doses per day. We want to encourage people. Don't let the Christmas period be a deterrent for getting your boosters. As a matter of fact, because it's Christmas, because you are in supermarkets, because you are out shopping, because you are doing Christmas activities with persons you may not normally see, it is more imperative that you get your booster according to the schedule that we have put out. The schedule that we have put out for the boosters runs until January the 7th, depending on the time frame when you got your last shot. It is going to be a rolling 1 month program. So by the end of December, we'll be putting out the schedule for February going into March, depending on when you got your second shot of a two-dose regime or when you got your Johnson & Johnson shot. So you will be included in a rolling 1 month program as we go forward. So those are the vaccination statistics. I just want to end by saying that the statistics we are seeing in our A&Es are very, very bad. 90% are unvaccinated. And the deaths continue to be overall about 96% unvaccinated. So at the end of the day, the message is vaccinate this Christmas. I will lead by example in my home and have absolutely no Christmas activities at home. This is a time for all of us to be as quiet as possible, to be as careful as possible, to be as vigilant as possible, and to protect your life this Christmas by being vaccinated and avoiding crowds. Thank you very much, Prime Minister.
Thank you very much, Minister Dayal Singh. Sometime in the not too distant past, maybe a year ago or 9 months ago, I spoke to the country from this platform as we were receiving the information, being infected by the virus, and were focusing on the effects that began to be experienced by us. Today, it is with a certain amount of sadness and disappointment that I ask the CMO to come to the microphone and let's talk about the funeral homes and the management of the dead.
Sure. Thank you, Prime Minister. So basically, I mean, it's something that we have been doing for a little while now. There's a team established under the Ministry of Health to look at the preparation for persons dying from COVID and any other cause. So through the Funeral Homes Association and collaboration with the Ministry of Health, we are looking to establish a mass site for storage in the Freeport area, which should be coming on stream shortly, and additional sites within different funeral agencies for storage. And that is being led through the Ministry of Health, the Chief Public Health Inspector, as well as the Director of Veterinary Public Health. It's a necessary step, as the Prime Minister has said, and a step that we have been putting off from the Ministry of Health as long as we could.
Thank you very much, CMO. Ladies and gentlemen, there are some undisputed facts and there are some national concerns that go with those undisputed facts. First and foremost of the undisputed facts is that this date and for the days and weeks ahead in the medium term, apparently, we will be required to continue to respond to a pandemic which is doing everything except receding. Just when we thought that we were getting the worst of the Delta variant, which we were frightened by before it got to our country, it did get here. It's raging in Trinidad and Tobago. It's the main component in many countries. We are, in fact, getting possibly the worst of the pandemics that we have had to experience in the last century and a half or thereabouts. That is a fact. One may get the impression from time to time, given the reaction of some people to the inconveniences or the threats, that this matter is not important. Everything else is important, except that we are having to acknowledge that the undisputed fact is we are now the subject of an onslaught from a virus which has killed almost 5 million people. And what is worse, as Dr. Richards is pointing out to us, we are struggling to provide health care for our population even before we become subject to the accelerating effects of the Omicron virus. It is almost a given that that virus will get amongst us, that variant, just like the Delta got among us. Some people comfort themselves by saying, well, if we had closed the border with galvanized sheets all the way around the country, we wouldn't have got the Brazilian variant and we wouldn't have got this and that. But you notice it's probably sheer luck and the working of the systems that we put in place that allowed us to pick up those two or three people. They could easily have slipped through. And there might be others that have slipped through because the last person who is mentioned there, had that person not been very responsible in managing his or her situation, or had uh, the presentation of the clinical symptoms not been identified early, that person could have been out and about amongst us as easily as that. That is how the virus is spread. And it's being spread around the world, 77 countries. I monitor on a, probably on an hourly basis what is happening to other populations around the world, from Africa to New Zealand to the United States to the United Kingdom to the Caribbean. And governments are struggling, either in preparation or in reaction to, or reporting that their health systems, superior health systems, are in fact being overwhelmed or threatened to be overwhelmed. I see some people are taking the opportunity to gloat over the fact and telling the country that our parallel healthcare system has collapsed. The system has not collapsed. It had a certain capacity. That capacity worked well to a certain level of infection, a certain number of people requiring service, and throughout the system, it's still there, doing exactly what it was supposed to do. But the volume of demand is now too great for the system that we have in place. So, in other words, we have extended the provision of healthcare out of the parallel healthcare system, which has not collapsed, but is overwhelmed. It cannot cope with everything. Other areas are now being affected. Other areas are now being called to flight. So that's what it is. And of course, we in Trinidad and Tobago, from day one, have taken the position that the government acknowledges that there is a pandemic to be responded to, and there were certain protocols and guidelines be put in place. Initially, we had a certain component of cooperation that worked. We then got vaccines, and the other undisputed fact is that there are significant benefits to be had where a vaccinated population is the best position to be in 2021 responding to the COVID variants. That's an undisputed fact. The third undisputed fact is that the demand on the healthcare systems, parallel and others, is largely being made by people who are unvaccinated. And two things happen to the unvaccinated. One, they react worse to infections, and two, they allow the virus to move with a greater ease among populations. So in short, the more vaccinated the population is, the better is the possibility of responding with an outcome that is not as disastrous as it could be. It does not say that a vaccinated population is immune to the threat and the effects of the virus, because if that was so, countries like the United Kingdom, New Zealand, Canada, and elsewhere, they would have been out of this and gone. As a matter of fact, what is happening now is that much of the opening up that has taken place in those countries, you're seeing rollbacks because the variants resulting in a heavier level of infection and greater demand on the healthcare. And in order to suppress the outcome being a high volume of deaths, that the vaccination programs in those countries are accelerated simply because there is no other more efficacious response available. And I want to repeat that for those who have not understood that. In this pandemic of 2020 to the present, there is no other response that is known to be better than to be vaccinated. I'm the bearer of that news. I'm not the creator of those facts. And I want to bring it home to the population of uncooperators. We are in this same position with our children for measles and for polio. The only difference is that you didn't have a wall of death in front of you, and you could have if you don't vaccinate children. And with polio, I need not tell you what the outcome was or is. And the population responded by accepting that our only way out to protect that cohort of the population of those who were exposed to measles and a few other ailments and to polio is to vaccinate them, to vaccinate us. And we have in fact prevailed over those ailments. That's the only difference. Now, the COVID situation is that there's a virus threatening us in a similar way, and the outcome is about a 15% sick people. And what percentage of morbidity? Well, if you get sick, a percentage of that are people who get sick enough to require hospital care, and some of those require extensive hospital care in the intensive care unit or the high dependency unit, and the outcome in some cases is death. And every day we receive the reports. I remember distinctly when the first person died from COVID in this country. It was a source of great agitation and aspiration for some people. But the first person, when one person died from COVID in this country took note. This country was frightened by it. This country responded. Today, it's normal. 20 dead, 30 dead. The potential for higher numbers of deaths, not stirring any response. Because I've been monitoring the rate of vaccination in the face of that level of deaths. And there's no movement in the response to get vaccinated. Because obviously, a half of the population is taking the position for whatever reason, and there are many, many reasons that we are not going to be accounted among those who will use the escape hatch that is available to the world's population. And that means, what do? We can wait the virus out, see towards the end. Because in all these situations, the whole population doesn't get wiped out. Eventually, the virus itself will run its course, and the effect on the population could have been devastating, but biologically, it has been shown that that is not an option available to us. Countries have governments to intervene in situations like this. Some countries have forced vaccination. We don't have that in this country. Some countries have confined the unvaccinated to remaining at home. Others have shut off access to certain aspects of the national activity to the unvaccinated. In some cases, fines have been imposed on people for not cooperating with the national effort. These are some of the things that have happened around, and is happening around the world. But by and large, it is all in the context of acknowledging that we need to improve our vaccination if we are, in fact, going to respond better or save ourselves from disaster. For many weeks, Dr. Richards would show us that graph with a line, the red line, 75% of hospital bed availability. And we were well below that line, and we took in action. We also did something else too. We got to the point where we accepted that we had to have some aspects of our economy operating. So we opened up our economy to be able to have a livelihood for most people. But we knew that by doing that, the risk of being exposed to the virus was greater. And we expected and anticipated that that would have generated a protective response. That has not happened. The opening up has taken place. If Dr. Hines is to show you a graph, there's a graph there that shows where the projections are going that way upwards. And that one, you see those lines, that the single lines that come off, those were our projections. But you notice the blue fell away below each one. Those were interventions made. And also you see the height of that curve had to do with the opening up of the economy. And as we opened up the economy, that risk and that infection level was growing because more people were out there doing what the virus wanted us to do. Well, we did it. And the projections from that was, you saw the green line, but we took some action there. The effect fell below. Then you see that single red line, that was the projection. And of course, as the economy opened up, the height of the levels of infection was higher. And of course, you see where we are out there in the far right corner. That now requires intervention. That intervention could be shut down the economy. We've taken the position that we're not going to do that. Because if we do that, we will create circumstances that would be almost as unpleasant as the circumstances of the growth of that infection level. What we have to do is to take steps to have more people vaccinated, which means that we're coming up against half of the population that is saying, I don't agree and I won't cooperate. Those are the facts. We've initiated the safe zone mechanism in the private sector where people volunteer their businesses as safe zones, and business in those areas were restricted and are restricted to only those persons who are in fact vaccinated and therefore are operating at a slightly better level of exposure. And of course, we have had the booster program because we are guided by the science, which says that if you've had your vaccination, because of the observed level of immunity which the vaccination bring, it was determined that we needed to extend that vaccination exercise into a third shot. In some instances, it was a two-shot boost vaccine. In fact, some countries are now determining that you are only fully vaccinated if you have had the booster shot, because that is where the science is taking us. We are encouraging people who have had the vaccination. If you've had two shots and a two-shot vaccine, the door is wide open, the encouragement is there. Go out and get your booster. This is our way of responding to a virus that is killing people. It's not that anybody wants to punish you. Excuse me. It's not that the Prime Minister wants to throw his weight around. It is that the scientists, the world's body of scientists, and the undisputed facts are that that booster shot raises your immunity considerably, and you should want to have that improved immunity. Those people who point to the fact that, yes, vaccinated people are getting infected and some are even dying, that is true. That's an undisputed fact. We have never said the vaccines will prevent you from getting infected. We said it will make you respond better if and when you are infected. And of course, in a population of 100%, we are seeing some of the vaccinated people, a few of them will get infected, fewer of them will get sick enough to want hospital care, and even far fewer numbers would die from it. So don't use that as an excuse not to cooperate. It's like saying that tires blow out and the car crash and kill people, so we shouldn't use tires on cars. That's the level of that kind of argument. So, ladies and gentlemen, we have come to the point where the government will have to take certain actions. And of course, what is required is a matter that came up on, I received these documents on an ongoing basis. And this one is dated December 9th. So since December 9th, I've been dealing with this document. And on page 6, item 4, it says to me, consider urgent policy measures to increase the rate of vaccination among the population. That is an imperative. That is not your job, members of the media. It's not your job, wherever you might be out there. This is a request to the government. And the government's job is different to many other jobs in the country. And of course, in situations like this, the Prime Minister, as head of the cabinet, is probably the loneliest person in the country. but I signed up for that. And I've taken the oath of office to act without fear or favor, without malice or ill will. And if ever a prime minister was called upon to act without fear or favor, malice or ill will, that time is now. And I will do so without fear or favor, without malice or ill will. Ladies and gentlemen, these urgent policy measures, I have had extensive discussion with the Attorney General and his support team in his ministry and his advisors outside. And we will now move to a situation of insisting that people in Trinidad and Tobago acknowledge the government's policy, this nation's policy, that vaccination is our best way of dealing with this carrier of death and destruction. But we'll try to make it as palatable as possible. So, the following effects will come into place. We will attempt to encourage and increase the level of vaccination, the government being the largest employer of labor. After almost 2 years and constant cogitation on this matter, I think everybody knows what each person's position is on it. But the government's workplace is going to change. It is the intention of the government come mid-January to insist that the government's workplace would require vaccinated workers. We will put things in place to identify such status, and persons who are not prepared or for reasons other than medically certified reasons, because there are people for whom the vaccination is not recommended by the health caregiver, the doctors, and such persons will most properly be exempted. But outside of that, the government's workplace will require, if you are a government employee, that you show your vaccination status, failing which you would not be encouraged in the workplace. And if you are not in a position to come to the workplace, you would be on leave on your own and you would be furloughed, meaning that you will still have a job on the establishment, but you choosing not to be able to come to work under the conditions laid down, that you will then not be paid. Because if we say that you stay away because you don't like the vaccination program and you're paid, then we'll generate 100% stay home. That's not what is called for. What is called for is what the young doctor pleaded for in public recently after a long interview. And the interviewer asked the young doctor, "What do you say to the population now? What help can we give you?" And he said, "Please get vaccinated." Because the unvaccinated is driving this pressure on a limited number of health caregivers who have been at the breach from the beginning and are now being continued to be called upon to stay there. And while they are, in fact, in some instances, there are some people willing to give up the job because the nature of the job is now so stressful and traumatic. While they are in that situation, there are other people exercising their rights, and their rights are to put more pressure on other people's rights. The right to not be in that situation. To heaven, when you will make a decision if you're working with the government, the state enterprises as well. And let me show you where we are at the moment because I spent the last week getting reasonable estimations of where we are. Could you put the slides up? In the public sector, these are our staff complements. These are the people in the various sectors. And I don't think that state enterprise figure is correct. It's probably it's lower than it should be. Next slide, please. And these are the vaccination risks that we have been able to identify, estimates. Ministry, and this is the Ministry of Health. This is the Ministry of Health. The staff at the Ministry of Health, and this is not the, well, you'll ask who qualifies as staff, but let's use staff as the general people who work in the Ministry of Health. 75%. That is not bad overall, right? But let's go down. SWRHA 80%. Just come back a little bit. SWRHA 80%. The ERHA 71%. Continue. The TRHA 50%. And NCRHA and NWRHA less than 50%. That's the level of vaccination in the Ministry of Health. Continue. Continue. Police service, 49%. The prisons, 35%. The defense force, 30%. Now, the operational daily interaction of people in these three departments, one would expect that they would have appreciated their room together in some cases. They share motor vehicles on an ongoing basis. They share offices because of the close quarter in which they are operating. Clearly, that level, immigration 25%, fire services 20%. Foreigners coming into this country, you just heard the minister saying that the 3 people we picked up with Omicron, the very first people that any traveler is likely to meet coming into the country is immigration. They are 25% vaccination. Fire services, 20%. These are government employees who obviously have, for some reason, decided that they are not going to take part in the national program to protect the national population from what, in effect, is a killing virus. That's the fact. That's the fact. Next one. All right, so those are the levels and the numbers involved. Carry on. Ministries. Ministry of Tourism, 75%. AG's office, 61%. Trade and Industry, 60%. Personnel Department, 87%. Inland Revenue, 45%. CPEP workers, 41%. OJT, 75%. URP, 60%. Now, in the state enterprise sector, NGC 75%, FCB 72%, UTC 69%. CAL 100% among stewards and 98% among pilots. Flip the code 50%. Now, in the non-energy sector, we're up at 73%. Petrochemical industry 80%, upstream 80%. What you see here is in the private sector and the state enterprise sector in energy, we were able to have a fairly high level of vaccination. And I think that has to do with the management of those sectors and the greater appreciation by those employees that they protect themselves and the rest of the country. Republic Bank 90%, Shell and off-base staff 90%. So it is possible in some sectors, in this requirement to get vaccinated and use the vaccination as the protection against this intruder. But only some sectors have been able to accomplish it or has made any effort to accomplish it. And the biggest delinquent is the government. And that is why the government is now having to act. Because we can't rely on what others have done if the largest component and the largest employer of people is not able to do what is required to be done. I know there will be a lot of response to this, but let all those responses be grounded in the foundational argument that there is a pandemic taking place in the world. People are dying by the millions. People are dying by the tens per day. Our average here is about 1 hour in Trinidad and Tobago. And if we don't intervene, the outcome is one of delinquency. A government cannot accept delinquency in a pandemic. And nobody ever said that it was going to be easy. Nobody ever said it was going to be painless. What we've always said is that we'll do what is required to be done to bring all of us out of this as best we could. And that is where we are at the moment. So we've set mid-January as to the time when this will kick in. The relevant legal amendments will be made to the laws so as to allow this to kick in. And we give you time to reflect, to ponder, and to cooperate. Ladies and gentlemen, this is being done at the end of the year. We are in the Christmas season. We are at our worst position in the pandemic at the height of the Christmas season of the second year. What a time. What a state to be in. And I know that there are people who will tell you that's because the government is incompetent, and that is because the government is this and the, just don't listen to that. Because that is the easy way out of a difficult situation. If that was so, then other countries and other governments would not be in the same situation. The only place that they have this government and they have me as prime minister is here. So that kind of argument is not to influence you, to try to kill yourself and to kill your people at home by responding improperly. There is no guarantee where health is concerned. None. I was watching a basketball match once, and these are among the fittest athletes in the world. They get the best medical attention, they get the best medical care. And I'm watching this game, and a guy falls down, he drops dead. Because he had cardiac problems that weren't picked up. And on the game, he just collapsed on the game and died. Health and tomorrow, there's no promise to that. A lot of it depends on you to manage your health care. And in this situation, where there's a killer from the outside to enter your body and kill you, it depends on you. And in this case, your behavior, your response has a knock-on effect on other people. And that is the problem. I have been making this case from this platform for almost 2 years. Us. Those families that are infected, I have known families where 3 people from one family died. 3 people. I've known families where 2 people die within a week of each other. That's what's happening. And it appears as though the rest of the population is not interested in that. Those who will stand in contravention of my argument and the government's position, those positions never raise as a consideration that these things are happening. Because that is not their job. The job of the government is to do what is best, to give everybody in this country the best opportunity to survive and to participate. And we will do so without fear, without favor, without malice, and without ill will. The public sector, because we know that one of the things that we could do, ask you to minimize your exposure. We ask you to do other things. Ask you to keep sanitizing. Ask you to wear the mask when you're close to other people in public places and so on. ask you to not congregate, and we ask you to get vaccinated. We know it's Christmas, but from the 24th, which is Friday, we will take the opportunity to shut the public service down from Friday 24th to January 2nd. So you come back out to work on the 3rd. So the days of the shutdown for the public service would be from Friday to the Sunday after New Year's. This is not an invitation to go out there and congregate long time and see you. This is an invitation to stay at home. Stay close in whatever bubble that you would have created. Try and protect yourself. If on the other hand, you decide to use it to congregate, it will have the opposite effect. And that is why we appeal to you to be responsible. Also, because of what I've said about what is to come in January, we are asking you to use this period to get vaccinated, to get boosted. And of course, this will apply to all except the essential services. The essential service staff will still continue. The indoors versus outdoor, we know what that is. It's better to be a little outdoors, but in small groups, and also maintaining the established protocols. Groups of no more than 10, better groups of 5 if you can, but try to make it family exercises only. Do not organize or attend Christmas parties. Do not expose yourself to people who you think might expose you to the virus. If you don't know their bubble status, try and, in a courteous way, preserve your status. It is personal self-preservation. Must be a disciplined people. This fight against the pandemic calls for discipline. I know that blame throwing replaces discipline in our society. Let us assure that discipline they are. In cooperating and collaborating with instructions in those environments. Status. If you are not vaccinated, you will not be in the best position. And I tell the population that I have not come to this position from an easy place. I have come to it after a long period we has to do if we are to come out of this pandemic. Having not left behind thousands and thousands of bodies. The older people who tend to get up early in the morning and go and have that. That dip in the sea. We will only for approaching the beach as a another normal environment. We hope that we can be disciplined enough to do that. If it turns out that everybody like lemmings rush 77 countries, much of them. The Attorney General and his staff and the team that is persons who please use that time. I am advised that the Ministry of Health would be
garden media and this is in relation to the
that the list of people that you mentioned there. They are part of the national effort in understanding that there's a pandemic going
is this specifically in terms of this is going to offices?
If,
That's I'm wondering.
if the management of the public service identified secondary school children have only had smatterings of being to school last term, we had 4, 5, and 6 out. And as of now, we haven't changed that, and we'll see how that pans out in early January.
Also, Prime Minister, in terms of how the vaccination for public sector workers are going to roll out, when they are allowed to come back out, I think it's mid-January, Is it going to be that they should be fully vaccinated if they take a two-dose regimen after the 2 weeks, or are you going to allow one dose? How exactly is it going to be?
Attorney General, could you explain that out?
Good afternoon, everyone, Honorable Prime Minister, colleagues, uh, health team, ladies and gentlemen of the media. The, the rollout is going to involve an amendment to the law, which is the Public Health Ordinance. The Public Health Ordinance is the parent act which treats with dangerous infectious diseases and infectious diseases. Under that law, emergency aspects can be triggered, as you're well aware, by regulations. So the Minister of Health has been publishing regulations from time to time. We propose to amend the Parent Act to specifically include in the law sections which will allow for certain dangerous infectious diseases or infectious diseases, because there may be more than just the COVID-19 particular disease, to be declared, put into a schedule, and then in that subset of those certain types, because it may not be that every dangerous infectious disease requires a vaccine, as medical advice comes globally and then is accepted locally, we then specify the persons to whom that law is going to apply. Obviously, we will utilize regulations. And in the regulatory aspect, having amended the parent law, we're then going to say the terms and conditions. So as the Honorable Prime Minister said, if you are in the situation of being within a listed category of persons, starting off, the list will start off with the public sector, state enterprises, government entities, because government entities are much more than just a ministry. You may have a government body, the HTC is a statutory body, etc. So we list those out, and then persons are required, if they want to work, to present a vaccine or a medical exemption certificate. And if you have a medical exemption certificate, then a regime of exceptions. How do you test to make sure you're within it? And we're well accustomed to that in the safe zone policy. The difference between a classic safe zone and this is that the patrons who access the safe zone are not going to be required at this point to be vaccinated. But when you look to what has been done globally, and I wish to assure you that the AG's office and our several advisors, and I want to put on public record, the attorneys general in the Caribbean, we have all shared with each other our respective advices. Having looked at the law around the world, the Commonwealth, the CARICOM, we are confident that the law is a proportionate step. How we roll it out is the question. Now, you asked a very specific question. Permit me for that long run up to the answer. Your specific point is to be treated with by regulations. So the CMO's team is going to advise on the participation in the vaccine program. As you know, under the vaccinate to operate policy, the government has already demonstrated how a single dose of a two-dose regime can apply, how the Johnson & Johnson will apply. Remember, we have close to 2 million vaccines, a menu of vaccines. We have Pfizer, we have Johnson & Johnson, we have Sinopharm, we have AstraZeneca. And in that menu, we'll be guided by the CMO's team. It'll be published in the regulations how you enter the program. So the law will contemplate a transition mechanism to operationalize itself. Specifically, the law will contemplate the circumstances of being what we call absent without leave. Because if you don't fall into the category of meeting the requirements of being vaccinated or presenting with a medical exemption certificate, then you're going to be absent without leave. And that absent without leave has the consequences that the Honorable Prime Minister described as being furloughed, in effect, running down to not receiving your pay and other consequences. You did ask a question earlier about consultation, Raphael, and what I can say is that there has been a significant amount of information. The Prime Minister has instructed me to ensure that steps are taken in terms of ventilation and other issues. It is quite remarkable to give forewarning, as the Honorable Prime Minister is doing now. The law is intended to come to the Parliament in January, and therefore, as you know, there's adequate room for us to have some more discussion about the issues. Okay? Unless you have any further questions for me.
But in general, just wondering, so in terms of the issue of collective bargaining agreements and things of that nature with regard to public sector workers, did you do a deep examination of that as well, and also the constitutional side of it?
So we have looked at constitutional, industrial relations, the general public health dynamics. We've looked at the laws and judgments coming out of multiple jurisdictions around the earth, literally. We have had umpteen pieces of advice on this, and I have also taken the caution of having discussions with my colleagues, attorneys general from many countries around the earth. So we have done a lot of homework in relation to this. This is not something that is just a snap decision. Today, the CMO demonstrated something which was extremely important. You see that curve line that you see, and there are little tangents that go up, and then the blue line falls down. The Prime Minister brought that graph up. In the United Kingdom with Omicron, which is a dangerously infectious type of variant. That's the graph. You see those tangents that go up and then the blue falls under? Because measures were taken, they didn't go along the trajectory. In the United Kingdom, there's no curved line. It's a perpendicular line. The perpendicular line means you just automatically fill all blue. And that's what Omicron is developing right now as. So the data presented prior to these meetings, but there's a whole team discussion and data analysis. In the countries where Omicron has anchored itself, there's a block. It is a perpendicular line. And therefore, under the Public Health Act, which is the ordinance, the obligation for the minister to act is in circumstances of a dangerous infectious disease. And that's why our courts, up to the Court of Appeal, etc., have upheld the constitutionality of our regulations in many cases that have come forward so far. Majority. We've carefully considered that issue and taken wide advice on it. And secondly, yes, it includes all statutory authorities, regional health authorities, state enterprises, and as you're well aware, the THA is a statutory authority with a peculiar characteristic about it, but it is a creature of statute. Thank you, Honorable Prime Minister.
Keep getting questions. People want clarification on the teachers, especially because I know it's a government
are both vaccinated. But you recall that safe zones were done not in respect of schools. What we did in schools is that we only had some of them based upon the characteristics of exposure in there. All teachers fall under, in the public sector side of it, for sure, fall under the positions, and the position is for all teachers to be captured by this law as well, subject, of course, to the exemptions for medical reasons and testing and other aspects.
I did receive a question from someone just asking for clarity in terms of when the public sector that closure during the week, except essential services, whether registration of debts would fall as that.
Yes, so the Attorney General's office will, so part of the essential aspects of operation include births and deaths, etc. And we have what we call emergency mechanisms that work into that structure, and we will continue to be operating that way. All essential services, remember that's not just law enforcement, air traffic controllers, TN Tech, WASA, we're well accustomed now because of the operation to know, as Prime Minister said, who's essential and who's not. Thank you.
Prime Minister, in terms of the reopening of the beaches, did you give a date as to when that would have
We start on Monday.
this Monday.
Just
Monday.
what?
Yeah.
Okay. And you did say waterfronts before you said beaches,
No,
so
beaches,
does that
yeah, beaches, yeah. No, not rivers, not rivers, pools, ponds, beaches.
In terms of the monitoring side of it, in light of what you are asking, no alcohol, no gathering, and so on, is that a component in terms of national security that would?
Yes, but if, we also we will continue to rely on our national security entities to enforce the laws in Trinidad and Tobago.
Minister Dial, thanks for question. Since the World Health Organization approved the Pfizer as a booster for Sinopharm, will people who go to get the booster shot, will they be encouraged to take the Sinopharm? I mean, sorry, the Pfizer? Will they be encouraged? Do they have the option? That sort of thing.
Yes, thanks. So it's not that we encourage. There is a choice now of vaccines that you could be boosted with. So basically, with the exception of AstraZeneca, which we no longer have in the system, all vaccines that you received, whether it's Sinopharm, Pfizer, J&J, or AstraZeneca, all of those now can be boosted with any other vaccine. What we ask people to do, don't just make the choice willy-nilly. You can speak to your doctor, you can speak to your healthcare professional and see which booster is best for you, right? I just want to make one further announcement, please. Coming out of my meeting yesterday with CEOs and doctors to prepare for the upcoming crunch and to make sure that healthcare workers are not overstretched, we have taken the following decision. We are going to be now diverting resources from our non-COVID areas, non-COVID, non-critical areas, like some outpatient clinics, some elective surgeries, to our high demand COVID areas as each RHA determines. In other words, the step which we didn't want to take, that is shutting down certain outpatient clinics, we are going to have to take that decision now. Arrangements will be made for alternative methods of communication and giving people advice, whether it's via telemedicine, automatic prescription refills, and alternate walk-in arrangements. This is because the unvaccinated have now impacted the services that can be delivered. It is a last resort measures that healthcare systems around the world fall that have to take. We took this last year, we took this earlier this year, we now have to take it again. So we'll be diverting human resources from non-COVID areas as each RHA determines to COVID areas. Thank you very much.
In terms of the concept, Prime Minister, of making the public service safe zones as a group, different divisions and so on, was that the safe zones initiative in the private sector factor into that decision? In other words, we satisfied with that and that led to, in part, the decision.
Well, the initiative is still worthwhile, it's still working, and it is one of the few options that we have to get the benefit of the vaccination program so that people who are vaccinated can have some kind of activity which they otherwise would not have had. So there are benefits to being vaccinated.
Many concerns in terms of even at the safe zones, as more people may have the opportunity to be out, if let's say the public service is on leave and so on, in terms of how you would speak to the safe zones, the restaurants, bars, and so on.
Well, just follow the regulations and observe the law. A lot of what we are saying and doing here requires that we be a law-abiding group of people. If you decide not to be law-abiding, then you'd find yourself at variance with the expectation of the national population and the laws of the country. It is an inconvenience for some people to observe the laws as they're requested, but there's a purpose to it. And I want to repeat this. None of this is aimed at any particular person or any particular body. It is aimed at restraining a virus from damaging and killing us. So I don't want you all to forget that.
Prime Minister, well, public sector workers would be dealt with from January. In terms of a timeline, when do you see this same initiative being taken with regard to private sector?
The private sector is leading the government on this. In fact, I want to add the data I showed you. shows that the private sector responded better than the private sector, than the public sector. What is happening here? All that is happening here, we're not we're not differentiating people because they are public sector. We see one body of human beings in Trinidad as far as the virus is concerned, but those people who are in fact working for the state are required now to participate more in the national vaccination program, because the national vaccination program is the best option that the nation has to not allow itself to be overwhelmed by the COVID virus. That's all it is.
Do you foresee legislation in the future for private sector workers?
The legislation will cover all eventualities and will only be um, crafted to serve as fit for purpose.
Private sector chambers actually have the various commerce chambers of commerce have been calling for um, adjustments to the legal adjustments for policy for government to mandate vaccinations, and so they will be able to do so more easily. Is that a possibility?
Well, we'll take on board what is required. We'll adjust. We go to the parliament, we'll make changes where the changes are required to be made, and it will apply appropriately. We're not aiming to have ad hominem legislation.
I have a question to the Health Minister. Well, two actually. In terms of the issue of vaccination of children below the age of 5,
Yes.
any update on that?
Yeah. So let's break up children under 12 into two groups: 0 to 5, 5 to 11. Um, both Sinopharm and Pfizer are before WHO for EUL for the 5 to 11 group. The latest research on the 0 to 5 you may have seen coming out of the United States is a little bit sketchy at this point in time. So there's no definitive statement. So what is further to the finish line is a vaccine for WHO approval for the 5 to 11. In the case of Pfizer, what they have proposed to the WHO is this basically the same Pfizer vaccine, which is an mRNA vaccine being used for adults, but you cut the dose to one third of the dose. You also slightly change the chemical composition of the non vaccine components. There's something called a buffer, which maintains the pH and the alkalinity and the acidity of the vaccine. They have changed the buffer for the pediatric doses, and they have changed the packaging. So what will be available is that formulation and new packaging once approved. We have already, uh, some time ago, put in our request, both the Pfizer bilaterally and via CARPHA, via the CARICOM initiative, to obtain those vaccines for the 5 to 11 age cohort once they become available. Okay?
It depends on the WHO, its guidance and so on. So in terms of the new, the announcement in terms of the mixing of vaccines and whatnot, but has the health ministry done its own sort of analysis and looking at it, let's say someone who had 2 doses of Sinopharm and then getting a booster, additional dose of a vaccine like say Pfizer, or that is not like the Sinopharm, for example.
So I'm trying to decide. Just explain what is the question. Yeah.
Sinopharm is a construct of one type of vaccine.
Yes.
The Pfizer and so on is another type of vaccine.
Yes.
So I'm wondering if the ministry has had its own analysis looking at this issue, apart from what the WHO would have said.
So I will ask the CMO to come and take that question. So while he's coming up, there are three basic platforms for vaccines: mRNA, viral vector, and the inactivated vaccines. And the CMO will now go into that.
Yeah, so generally, you're speaking about two different things, right? There's the homologous vaccines, which are the same for the same, right? So Sinopharm, Sinopharm, Sinopharm. There's heterologous, which is mixing. The guidance is, generally speaking, you've seen a slightly better effect with the heterologous vaccines, so mixing of different types, coming out of data from Canada and other countries that have done so because of supply challenges, for instance. So the ministry's national immunization tag group has looked at it as well, and we have found that to be the same. But as Minister said, you need to consult your physician because there's interpatient variances that will not allow you to take one vaccine or the other. So you get that guidance before you come. So you're balancing safety and efficacy as well. All right.
As you had podium, you did speak about, and correct me if I'm wrong, a sense of hesitancy, at least in terms of the issue of the mass storage sites, the site you had talked about.
Well, I think I mean, we have been planning for this eventuality for quite a while now from the Ministry of Health, looking at all parameters, working with the funeral homes. So, I mean, there's hesitancy generally for us to go to that place, right? Um, but I think we're working with them as best as we can to get everything in place in the event that we have to go further than this. But hopefully, with the measures that the Honorable Prime Minister has laid out and with the support of the country, following the public health guidelines as we did even before we had vaccines, we can get it under some sense of control and we won't get to that place where we really don't want to be.
Prime Minister, the THA Secretary of Health has described the health system in Tobago as critical. Has the central government actively engaged with the THA to try and work out some of the issues?
Central government, from the very onset of these challenges, the central government have been involved with the Tobago House of Assembly to ensure that the population in Tobago gets the kind of care and attention that is available and required. Um, I don't know that anything has changed there. The Minister of Health might be able to tell you. From time to time, we have to assist extraordinarily, but I'll ask the Minister of Health to indicate where we at with that. As you may know, I was a patient in Tobago when I did my isolation and quarantine. I contracted COVID in Tobago. I remained in Tobago and I was cared for by the Tobago Regional Health Authority. And I dare say I wouldn't have done so if I was not confident that we had in Tobago the foundation and the infrastructure so to do. So the minister can update
Yes,
you as to where we at.
thank you. So I do want to reassure the people of Tobago and Trinidad and Tobago that we treat all RHAs equally, but we treat TRHA a little bit specially because of distance and separation by water. We want to make sure that they never run out of resources. Because in Trinidad, you could rush to C40, you could rush to here by car, but in Tobago, you can't. So we have also always treated Tobago because of that separation specially. In Tobago, there are four levels of care. One, ICU, HDU, at the Scarborough General Hospital in a separate building with a dedicated staff arrangement. So that is a parallel system in Tobago. At the Trek facility, which is up at the Fort George, we treat only COVID patients there. So there's a parallel system. High acuity patients with oxygen therapy for 20 patients. We did that months ago. We also, at the Scarborough General Hospital, have a designated capacity for low to medium acuity patients for 25 patients, dedicated only to COVID. And I really want to thank Dr. Mariam Richards here. She doesn't get the acknowledgement that she deserves for helping Tobago and going to Tobago. Coming out of her visit, which she led on the instruction of the Honorable Prime Minister back in September, October, was it, Dr. Richards? July and September. These were some of the initiatives. We also planned and have activated the Lowlands facility, which is a step down facility with oxygen, which was opened this week. And that can house 26 persons in a parallel system. And the new ICU capacity at Tobago, um, both at the fort and at the hospital, for 6 new ICU patients. So Tobago has always been an integral part of the RHA system. But as I explained, we treat them a little bit specially because that distance in water. So they have always had more vaccines than they require, more testing that that they're required to give them that buffer. So the parallel healthcare system in Tobago is up and running and has been. And I pledge to the to my counterpart in Tobago and to the people of Tobago my fullest cooperation as we fight this pandemic together. Thank you very much, Prime Minister.
As we move ahead to vaccinate more of the population, is the ministry moving ahead with any plans to digitize the vaccination process or to digitize vaccination cards?
Yes, so Minister Young can bring you up to date on that. So whilst he is coming, I can tell you that the Ministry of Digital Transformation already has the solution in hand. The solution is there that your records could be on a phone, the QR codes, the QR readers, and Stuart is coming now to talk about that. And he
Let me
is
just,
approaching, Minister Young, the digitization of vaccination records.
before Minister Young takes that up, let me just say something to assist with this management of Tobago conversation that is going to get your attention. I was in Tobago in April as a patient of the Tobago Regional Health Authority. In July, I asked for a review of all systems and structures in
Mhm.
Tobago by sending senior technical staff from Trinidad to go to Tobago to review, to advise, to guide, and to learn about what was happening in Tobago. That was done. I repeated that request again in September, and that was done. So we've kept Tobago under constant review and care for all of 2020. And having been an integral part of the RHA system, we do not anticipate any out of the ordinary problems with Tobago as long as the managers and the authorities cooperate in the national effort. And at this stage, I'll ask Minister Young to describe where we are with respect to digitizing and using the digital technology to be able to manage the logistics of some of what I've said earlier on.
Thank you very much, Prime Minister, to our cabinet colleagues, the health team, members of the media viewing and listening public. We were actually preparing to launch the digital vaccine verification this week, but then when we did a quick assessment, there were some additional features we wanted to add to it. What we envisage, and we're hoping to be able to do it very shortly, launch it. You will go on to a website. At this stage, it is likely to be the TT BizLink website. There's going to be a portal there. Prior to going onto the website, you will need to have available with you your vaccine card. So the white card that we get, because it will tell you the dates that you vaccinated. Also, you must recall the form of ID you use when you went to do your vaccination. You will input that on a form that comes up on this TT BizLink portal. You'll put in your name, your address, your date of birth, the dates that you vaccinated, and the form of ID. The form of ID you use when you vaccinated is critical because that is part of the verification exercise portal, and that is where the verification will take place. Once you have put that information in and it does a very quick verification, it will then provide you within 24 hours, probably less, with your vaccine certificate. Your vaccine certificate will have your photograph on it. Oh, sorry, that's the other thing you have to have available. So you're working out whether it should be a JPEG or some other type of format. You will have a photo of yourself that you will upload the same way you do it on visa applications. Once you've put in those three sets of information, your vaccine dates, the form of ID you use, and your photograph, as well as your date of birth, name, etc., it will then provide you with a vaccine certificate which has a QR code. We have also built out a system that will be free for anybody to download that will not require internet connectivity, an app, both on the Google platform as well as the Apple platform, that you can then scan the QR code. So businesses, safe zones, including now government offices, once we reach that stage,
will be able to have this app on devices, and they just scan your QR code on your digital certificate, and it will provide you with a verification that yes, this is Stuart Young, and these are the dates that Stuart Young was vaccinated on, etc. And that those apps will be free of charge, and you will not have to be connected. So businesses don't need to have connection to the internet to be able to scan the QR codes. We also envisage you will not have to walk around with your full certificate. All right, it will be, of course, you could either print it out, it could be on your phone, your device, etc. But the main thing will be the QR code. One of the reasons we took a little longer is we decided to add the photograph, a person's photograph, because you have instances with children between the ages of 12 and 18 who had no form of ID and, for example, wanted to go to the cinema, they're fully vaccinated. So there was that dilemma. So we said we're adding it. And a little bit of the delay is we've also now asked the provider to have on the form of verification, when it comes up after you've scanned the QR code, the person's photograph. So you'll see, okay, this is actually Jewel Brown. This is what he looks like when you use the app and scan it. So that work is being done, and I'm going to be running a test. Minister Bacchus and his team have been doing a great job. We had a meeting at the end of last week, and we're running some other tests on Monday. Thereafter, I'll be able to tell the Prime Minister when we launch. We're hoping to be able to launch in this coming week.
Like state sector.
It has correct. So far, there's been no cost incurred with it. We've been working with health. So yes, so it is all being done by iGov TT under that umbrella, and Minister Bacchus and his team out of digitization.
The storage facility in Freeport, what type of facility is it, and what is the capacity?
While Dr. Parasram is getting to the microphone, I just want to let you know that I know we can get an unlimited amount of questions as you're taking questions coming into your phones, right? But we'll have to end very soon. So let's have one more question from each of you. Well, yeah, one more question. so we can try and wrap it up in a reasonable way, right? Yes,
Yeah,
Dr.
so that conversation is actually happening between, I could say it's a very large facility. They're in the process of doing an MOU between the Funeral Homes Association as well as the other funeral agencies. So I don't want to say too much until that MOU is completed, but it's a fairly large facility in terms of size. We can give all those details once those MOUs have been completed and signed.
In terms of
So it is something that is being done under the auspices of the the funeral agencies, that professional body. So they are dealing with all of it. It's not a cost to the state as far as I am aware at this point in time.
Well, I don't think we want to end. I don't think we want to end on the funeral aspect of things. I would like us to end on the more pleasant terms. So this is a good time for me to reiterate where we at. It's Christmas time. It's a dangerous time, but it's also a happy, hopeful time. And I'm appealing to the national population to pay attention to what is being said and what is being done to us. Pay attention to the threat that exists, which is some of it is already with us, and what is coming to us by these variants. And also, as you do that, try and protect yourself. Try and protect your family. Observe the guidelines. And in all of that, be happy to be alive. Be happy to be healthy, those of us who are healthy, whatever level of health we enjoy. And say that we will continue to fight as a nation against this unseen invader, which threatens our life and our livelihoods. And as you do that, let's not overdo for the Christmas. Let's have a careful Christmas, a protective Christmas, and look forward to a prosperous new year. I thank you all very much.
Introducing NLCB's multiplier trio of games.